Welcome to myTRIAList Trial Talk, Voices of Experience.
I was diagnosed on January 16th, 2020 with stage 2 breast cancer that was estrogen and progesterone positive. And it was in my left breast.
How did you learn about clinical trials?
I participated in a clinical trial at the beginning of my treatment, and it was actually recommended to me by my oncologist, who saw that I fit the criteria for the trial. At that time, I didn't. A lot of things are still hazy, but were hazy on the day of because it was so many things coming at me at the same time. And them asking me to join the trial at the beginning was a little nerve-wracking because so many new things was coming about.
What was the clinical trial enrollment process like?
My oncologist didn't share a lot of information about it because everything was so quick and they had to start it on with the treatment of chemotherapy, which happens pretty quickly. But one of the things I did know was you had to be estrogen and progesterone positive, and they had to have samples of your tumor through, like, I think it was like 3 samples. And I had done of course, the first biopsy, and then I had done a guided MRI biopsy where they actually removed several samples of the tumor. So those were the two main things that I knew that they needed in order for me to participate in the trial.
Can you tell us about your clinical trial experience?
I decided to join this trial, which was an immunotherapy trial. And they would basically be infusing the immunotherapy along with they were doing my chemo. But not every time I had a chemo infusion, but I think it was like every few weeks that I had the chemo infusion. It wasn't painful. It didn't take anything out of me because I was already going to the hospital so often for my regular infusion. So during the time of the trial, it was fine. I think it was just in the beginning, I was a little hesitant because it was so much information that was given to me, and I wasn't sure, like, do I want to add one more thing to the list to do?
How did you feel about clinical trials before enrolling in one?
I've been teaching science for maybe roughly 12 years. And we've talked about clinical trials in some of our lessons. And so I'm very familiar with clinical trials. I have seen the benefit of clinical trials in studying different things that we taught the students. So even though I had some knowledge about it, of course, I was a little scared. I was a little scared about what this could mean for my body, along with having cancer. So even though I had some knowledge, I was like, a part of me felt like, do I want to be the one? Am I going to be someone that maybe my kids will be, or future students, not mine, but like future students are going to be like researching about or learning about, when it comes to this trial. So I think there was more of a hesitancy even before being, like, no, I've had knowledge about clinical trials, but thinking about myself in a clinical trial is kind of like a different story. The research nurse at the hospital, they talked about immunotherapy with me, and it was just like they said that immunotherapy was used to help with other forms of cancer, and they found that it was actually successful. And so they were doing a trial on breast cancer patients to see whether or not it would help. And so having that information, because now I'm remembering, it kind of slipped my mind, but having that piece of information, knowing that it had actually helped other patients who had other forms of cancer, kind of also helped me in deciding to say yes. I forgot about that piece. And I knew immunotherapy was something that was good, like it's something to help your immune system. And so it kind of helped with definitely easing the anxiety a bit, having some form of information about it being successful.
Why did you decide to enroll in a clinical trial?
Ultimately, I made the decision because most people that join trials are not usually, they don't usually look like me. And so after talking to a few of my friends, I was like, I need to try this. I need to do it because, one, I'm a young woman, and we don't see too often a lot of young women with breast cancer. And two, I am a Black woman, and to join a trial and have that data stored somewhere for future research, I think it's helpful to, women that look like me that may be diagnosed, in the future.
Did you face any barriers when deciding to enroll in the trial?
To me, there weren't really any barriers, nothing, employment, finances, nothing. They gave money for cabs, and the money could have been used however I wanted to use it. And it was something that was replenished during the time that I was doing the trial, which was over, I want to say 16 weeks, a little bit more because uh, maybe around 20 weeks because I had the trial lasted longer than my chemo infusions, but I was still going to the hospital frequently. Um, so there weren't any barriers. And honestly, it wasn't painful. It was an infusion and I had my port in. It was just to me like another infusion that I had to do when it came to my treatment.
How did you find support throughout the clinical trial process?
I had a lot of support for the whole journey. But more specifically, when it came to the clinical trial, a lot of the support came from the research nurse and the nurses at the hospital. Everyone was just so kind and helpful and patient, and just genuinely cared for how I felt. I had to do a questionnaire based off of how I felt every, I want to say, couple of months. And this is information that they took down and are using it as data, but also used it to kind of sort of just ask me, hey, how's it going? How are you feeling? Do you need anything? Like, do you, how are you feeling emotionally? So, because like I said, during that time, I was we had to go to the hospital by ourselves. So honestly, the only people that were there were patients and, the staff, the doctors, the nurses. And so they were really, really, really supportive. I couldn't thank them enough. Outside of that, in terms of like being able to communicate with family and friends while I was there, or when I was home, everybody was so supportive, sorry, and I was so grateful for them.
How has cancer care helped you?
The biggest support was actually cancer care, where the hospital actually referred me to cancer care and their services, and that's where I met my therapist, my cancer therapist, who she really, really helped me navigate my treatment and all the things that I was feeling, and helped me to, process and walk myself back to reality. There were several times where, I was just, thinking the worst things. Also, I joined a group counseling with young women and men who have been diagnosed with cancer. And it was nice talking to them every week, expressing, how I'm feeling, what I'm going through, the different treatments that I'm going through, the clinical trial. And they were super, super supportive. And, I still have relationships with them to this day. Like if I need, to talk to them about something, if something comes up, I know that I can go to them. I actually saw them like what, last week we all met up to have dinner. But it's such a helpful, supportive group, and the things that we go through, even though there are people out there that want to be there for you, someone that has gone through a similar battle as you can understand things in a way that other people can't. And yeah, they're great. Yeah, they're great.
Was enrolling in a clinical trial the right decision for you? Was there a moment you realized you had made the right decision?
Enrolling in the trial was the right decision to make. And I think I knew it was the right decision when I made the decision to do it. Going to the treatment center, I felt like one of one, like there were, it wasn't a lot of young women there. And it shouldn't be no one there, honestly, but it wasn't a lot of young women there, and it wasn't a lot of young Black women. And so even knowing about like genetic markers and learning that was very interesting to me. Because I did a genetic testing and I didn't have any current genetic markers for breast cancer, but that's not because it may not exist. It's because there's not enough data that is there to share with us that, okay, you may have a genetic marker, because a lot of the research is not done on so many different types of women of different ages, of different ethnic groups and whatnot. And so I just think it's important to join things that people might be a little bit hesitant to do, because, cancer doesn't look like it did years ago, where it was just, where you would see just mostly older women getting it. It's so many different age ranges that are getting cancer and so many different types. And so I think when I made a decision, it was based off of that.
What questions would you tell someone that is considering a clinical trial to ask their doctor?
I would ask, well, how is this treatment going to be administered? How often is it going to be administered? What supports are available? Um, uh, what supports are available in terms of, transportation, or just convenience, because something that, if you're going to do something that isn't mandatory, it has to be somewhat convenient for you. So what supports are available that would allow it to be convenient for you?
How has the clinical trial impacted your quality of life?
Now that I'm on the other side, I am fine. I'm okay. I'm good, So I would say emotionally and mentally, it has helped me to realize that I can do things that scare me. I can do hard things. I can do things that, a lot of people probably would not do, and come out on the other side and still be okay.